Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. With a lot of pleasure and honor, I would like to thank the organizing committee and the chairperson, as well as the audience, for allowing us this opportunity to represent GE. My name is Ahmed Taher, and I will walk you through one of the advanced modules of TAVI planning, especially for pre-operative planning. So we all know the burden. We have seen the patients. 1 out of each 10 patients at the age of 75 plus suffers from aortic stenosis. And the surgical aortic stenosis valve replacement has become a conventional treatment. However, 1/3 of the patient suffer from severe aortic stenosis. TAVI has become the current standard of care for high risk and inoperable severe aortic stenosis cases. And the numbers of the procedures have drastically doubled during the past 5 to 10 years. CT is now the golden standard for TAVI preoperative planning. It's recommended for aortic root and for vascular access as well. Accurate and comprehensive assessment is the reason why we utilize these modules and these types of technology. And of course, collaboration, not only between the patient and the staff, also between the staff of the CT and the interventional staff as well, is crucial and is very important with the heart interventional team. So what are the challenges? Of course, time is one of the most important challenges. Sometimes this can take a lot of time, up to 5 minutes sometimes even. Accuracy is another challenge. If we have any specific limitations in the staffing or in the technology, then measurement accuracy is a huge challenge for us. Reporting is one of the last challenges that we might face as well. The media of the reporting and how we deliver the report to the specialized team is also one of the challenges. With TAVI Analysis module, we try to tackle some of these challenges with faster annulus detection, with automated and consistent accuracy, and with the best summary table that might be utilized with the interventional cardiology team. Again, the goal is not only to face the burden, but also to facilitate another mean of facing the challenges by automation and by guided workflow with efficient TAVI planning. The guided workflow of the efficient TAVI planning starts with identifying the annulus plane, then annulus contouring, then identifying the angulation and providing the proper measurements, assessment of calcifications, and summary table in the end. At the beginning, we start by 3-point deposit mode for precise refinement of the annular plane. Then we walk through the workflow to complete the pre-procedure planning measurements. Then the perpendicular view and the S-curve graph are demonstrated to identify the proper working angles and to support the interventional cardiology team. Automated estimation of the aortic valve calcification volume treatment, and eventually a summary table and the report is provided to the interventional cardiology team. This is how it looks like in the end. So depending on the intention of the interventional cardiologist, he can utilize the most important measurements of this report. And the good thing is that whenever we produce the report, the interventional cardiology team can actually utilize the images and do additional post-processing of these images. This is one of the study results, and it proves that 98% of correlations coefficient of the average aortic annular area to the reference standard measurement, up to 50% time saving with the analysis compared to the manual measurements, and last but not least, 90% of the suggested valve size is precise. So you can have this as an assisting tool in order to identify the proper device and the proper placement of the device. Thank you.
أي سؤال للدكتور أحمد، الأستاذ المهندس أحمد طه؟ يعني الدكتور أنطوان دلوقتي هيتكلم.